My name is Manvi and I'm currently a freshman who is attending Indian Land High. I'm passionate and interested in medicine, and especially mental health, which is why I'm excited to present my multimedia slideshow on animal-assisted therapy and mental health. Now that you know a little bit about me, let's talk about what we're going to talk about today. Stress, burnout, anxiety, and anger are major hurdles in healthcare, affecting both healthcare workers and patients negatively. Animal-assisted therapy, or AAT for short, provides therapy using animals to reduce stress and improve overall well-being. For healthcare workers, it decreases their stress and burnout, while for patients, it eases their anxiety and boosts their recovery. By using different policies, hospitals can implement AAT programs, creating a more supportive and healing environment, beneficial for everyone. What is stress, burnout, anxiety, and anger? Stress is a response to changes and challenges in life, causing the brain to think in fight or flight. As a result, it lowers a person's ability to think and increases their heart rate. Meanwhile, burnout is a type of chronic stress that leaves the person frustrated with themselves, depressed, detached, and feel useless, ultimately leaving the person the inability to perform tasks on a personal and professional level. Anxiety, on the other hand, fills a person with fear and nervousness, hindering their ability to think and perform any tasks. Lastly, anger leaves a person antagonizing someone or something that leaves them frustrated or upset. High levels of anger can result in anger attacks, leading to people being hurt and hinders one's ability to think. What are the effects of these emotions on healthcare providers? Stress and burnout among healthcare workers significantly impacts the quality of care and the hospitals they serve. These draining and emotionally exhausting emotions crumple a healthcare provider's mindset and ability to perform at their very best, leading to an increase in errors and dramatic decline in a person's quality of care and thinking in critical time, like surgeries. This results in hospitals suffering high turnover rates, increased absenteeism, and increasing recruitment and training costs just to deliver optimal care. Ultimately, these emotions create a negative atmosphere that compromise a hospital's ability to deliver efficient quality care and a patient's experience. To illustrate the gravity of this situation, this line chart depicts this situation. As you can see, in 1990, the rates of stress and burnout were relatively low. And as you can see, it has a steady increase all the way to 2010 due to emerging new technology, patient loads, and more administrative work. However, due to COVID-19 in 2020, these rates skyrocketed, resulting in a dramatic increase in emotional toll, working hours, patient loads, and administrative work. Post-recovery pandemic in 2024 will show a slight decrease. The shortage of healthcare providers mixed in with an increase of complex technologies, patient loads, and administration work will still keep the rates of these emotions at an all-time high and cause hospitals to burn a lot of money they wouldn't before to keep the quality of the care afloat. Now that's rough. What are the effects of these emotions on patients? Anxiety and anger, when left unaddressed in patients, have a profound impact on both the patient's well-being and overall efficiency of a hospital. You see, anxiety and anger magnify physical symptoms, hindering a healthcare provider to diagnose and treat a conditions. To make matters worse, heightened anxiety or fear results in a sharp increase of hospital readmissions, longer recovery times, and a strain on resources. This toxic environment can also hinder communication and relationships between a doctor and its patient, compromising the quality of care. The pie chart here shows the percentage of patients who felt anxious, angry, both or neither, while admitted in the hospital. As you can see, 50% report feeling anxious, 25% angry, and 12.5% reporting both and neither. Well, that's not awesome. What is ATT and what are the benefits? What is AAT and what are the benefits? Animal-assisted therapy, or AAT for short, is a therapeutic approach that uses volunteers and animals, typically dogs or cats, into treatment sessions where an individual can pet and interact with an animal to support emotional, mental, and physical health. AAT is proven to reduce stress, anxiety, and depression, and helps creating a comforting and joyful atmosphere. The bond formed between the animals can improve recovery and provide a sense of comfort and safety. The once stressed and fearful-filled hospital environments will be completely transformed into a compassionate and safe environment from one simple perk: reducing stress and burnout in healthcare workers, anxiety and anger in patients, cheaply and efficiently using volunteers. What hospital guidelines will we have to follow? Now, while guidelines do differ from state to state, the basic guidelines all hospitals will need to follow are: handlers must be over the age of 18, or at least 18, and have previous experience in either AAT or volunteer work to ensure they understand and respect healthcare practices. On top of this, all handlers must be up to date with vaccinations and have regular health evaluations to prevent diseases from spreading. Meanwhile, animals will at least need to be 1 or older and will need to complete an evaluation with the Pet Partners or Alliance of Therapy Dogs, which are both certified organizations in therapy animals. This will certify that animals won't react negatively to loud sounds, elevators, and strangers petting them in the hospital, as well as knowing how to remain on a leash and listen to commands. Furthermore, monthly health evaluations must be provided to make sure both the therapy animal and others interacting with the therapy animal don't contract any diseases. Animals also must be washed by non-toxic and non-fragrance products, and paws are washed before and after every visit. Lastly, hospitals will have to provide a feeding and resting time to ensure animals aren't mistreated or overworked. These will all be the basic policies used as a blueprint to admit volunteers and animals into the program. Now, according to the informed consent, all patients have the right to know and ask about a treatment. As a result, healthcare providers and the hospital itself should address every patient's and family's concerns and questions, and will also highlight any risks or burden involved if they were to participate in the program. On top of this, allergies and consent should be addressed and taken into consideration before any patient's participation. The Americans with Disabilities Act, or ADA, is an act that protects every American with a disabling condition in many different areas of public life. Hospitals are included in an area of public life. As a result, hospitals must ensure that patients and healthcare workers with disabling conditions are offered the option to interact with the therapy animal. Moreover, staff and handlers must clearly know that ADA doesn't cover therapy animals and only service animals. Therefore, staff must know that service animals are not allowed and cannot be present in all patient-accessible areas. However, animals working under the AAT program can only be allowed in spaces provided and approved by the hospital and its staff. Stress, burnout, anxiety, and anger are crippling emotions in healthcare. For staff, they lead to exhaustion and errors. For patients, they hinder recovery. Thankfully, animal-assisted therapy provides a cheap, powerful solution that calms racing minds, eases pain, and creates a safe environment. By introducing trained therapy animals, hospitals can heal not only the bodies, but spirits of its staff and patients. It's time to embrace the power of pause into our healthcare system. Thank you for your time today, and I'll take any questions you may have now.